Do you know the first signs of pancreatic disease? This question may seem daunting, but let's break it down together. Pancreatic disease refers to a group of conditions affecting the pancreas, an organ nestled deep inside your abdomen. This small but mighty organ plays a crucial role in both digestion and the regulation of blood sugar levels. Being aware of the early signs of pancreatic disease is important, as early detection can significantly improve the chances of effective treatment. Unfortunately, many of these conditions are silent killers, often showing no symptoms until they've reached an advanced stage. This makes understanding and recognizing the early signs even more critical. Pancreatic diseases can range from benign conditions like pancreatitis to more serious ones like pancreatic cancer. Regardless of the type, they all share one thing in common: the sooner they're detected, the better the outcome. Now, you may be wondering, what are the symptoms of pancreatic disease? Well, let's dive in. One of the most common and early signs of pancreatic disease is abdominal pain. This pain is often described as a dull, constant ache that seems to radiate from the abdomen to the back. It's a discomfort that's hard to pin down and can be mistaken for indigestion or a simple stomachache. But what sets this pain apart is its persistence. It doesn't fade away after a good night's sleep or a simple change in diet. Instead, it tends to linger, subtly reminding you that something is off. The location of the pain can provide a clue to its source. The pancreas is nestled deep in the abdomen, sandwiched between the stomach and the spine. Its position explains why the pain tends to be felt in the upper abdomen and can even extend to the back. Now, you might be wondering, why does pancreatic disease cause abdominal pain in the first place? Well, the pancreas plays a crucial role in digestion. It produces enzymes that break down fats and proteins, and hormones that regulate blood sugar levels. When the pancreas is diseased or inflamed, these processes can be disrupted, swelling can occur, and pressure can be exerted on nearby nerves, all of which contribute to the sensation of pain. Over time, this pain can change or even worsen. It might become more intense after eating or when lying down. This is due to the pancreas being stimulated to work harder during digestion, or increased pressure on the pancreas when in certain positions. It's important to note that everyone's experience with abdominal pain can be different. Some people may feel a sharp, stabbing pain, while others might experience it as a gnawing sensation. The pain might be intermittent or constant, mild or severe. It's a complex symptom with a myriad of presentations. So if you are experiencing a persistent, unexplained abdominal pain, it might be a sign of pancreatic disease. Recognizing this early sign can pave the way for prompt medical attention and potentially life-saving interventions. So, listen to your body. It's often the first to know when something's not quite right. Another significant symptom of pancreatic disease is jaundice. Now you may be asking, what exactly is jaundice? Well, jaundice is a condition that causes your skin and the whites of your eyes to turn yellow. It's a clear visual symptom that something is not quite right within your body. You may also notice that your urine becomes darker than usual, almost like a strong cup of tea. But why does jaundice occur? It all comes down to a substance in your body called bilirubin. Bilirubin is produced when your body breaks down old red blood cells. It's typically processed by your liver and then eliminated in your stool. However, if your liver is damaged, or if there is a blockage in the bile ducts, the tubes that transport bile from your liver to your intestines, bilirubin can build up in your body, leading to jaundice. So how does this relate to pancreatic disease? Well, the pancreas and the liver are close neighbors in your body, and they share a network of bile ducts. When a pancreatic disease, such as pancreatic cancer, causes a growth or inflammation, it can block these bile ducts. This blockage prevents the liver from being able to process and eliminate bilirubin, leading to a buildup of this substance in the body, and ultimately, jaundice. While jaundice is a significant symptom, it's important to remember that it's not exclusive to pancreatic disease. Other conditions such as hepatitis, gallstones, and other liver diseases can also cause jaundice. Therefore, if you or someone you know is experiencing these symptoms, it's crucial to seek medical attention. Jaundice isn't something to be ignored or brushed off as a simple skin or eye color change. It's a sign that your body is crying out for help, that something is wrong and needs attention. Don't be a hero trying to tough it out. Listen to your body and take action. Remember, jaundice is not normal and should always prompt a visit to your healthcare provider. Unexplained weight loss and loss of appetite can also be signs of pancreatic disease. This is a crucial conversation because the pancreas plays a vital role in our digestive system and metabolism. It secretes enzymes that aid in the digestion of food and produce insulin, a hormone that regulates blood sugar levels. When these functions are compromised, it can lead to surprising changes in your body weight and appetite. Imagine this: you're eating your regular meals, but you're losing weight without trying. It might feel like a dream for those wanting to shed a few pounds, but it's often not a good sign. When the pancreas is diseased, the production of digestive enzymes may be impaired. This means the food you eat isn't broken down sufficiently, and your body can't absorb all the nutrients it needs. Consequently, even though you're eating, your body is essentially starving, leading to unexplained weight loss. On the other hand, a loss of appetite can occur as well. This is often due to the discomfort or pain associated with pancreatic disease. The inflammation or tumors in the pancreas can press against other organs, causing discomfort and nausea, making food less appealing. Furthermore, because the body isn't absorbing nutrients effectively, you may feel full more quickly, further impacting your appetite. So, it's not just about the numbers on the scale, or your suddenly loose jeans. It's about understanding that your body might be signaling something is wrong. It's about recognizing that these changes are not the result of a new diet or exercise regimen, but a potential symptom of a serious health condition. However, it's important to remember that weight loss and loss of appetite are common symptoms for many conditions, not just pancreatic disease. They can occur due to stress, other gastrointestinal disorders, or even some medications. Therefore, it's always important to consult a healthcare provider if you experience these symptoms. If you notice a sudden change in your weight or appetite without any apparent reason, it could be a sign of a serious condition like pancreatic disease. So stay vigilant, listen to your body, and never hesitate to seek medical help when something doesn't feel right. Did you know that a sudden onset of diabetes can be a sign of pancreatic disease? This might be surprising, but let's delve into why this is the case. The pancreas is a key player in our body's endocrine system, the system responsible for producing and regulating hormones. One of these hormones is insulin, which plays a crucial role in managing the sugar levels in our blood. Now, when you eat, your body breaks down the food into glucose, a type of sugar, which then enters your bloodstream. That's where insulin comes into play. It acts like a key, unlocking your cells to allow glucose to enter and be used as energy. Without insulin, glucose cannot enter the cells and instead builds up in the bloodstream, leading to high blood sugar levels. Now imagine a scenario where the pancreas is under siege by disease. Pancreatic diseases such as pancreatitis or pancreatic cancer can damage the cells that produce insulin, leading to a decrease in its production. This in turn can lead to diabetes, a condition characterized by high blood sugar levels due to the body's inability to produce enough insulin or use it effectively. So, how does this connect to a sudden onset of diabetes being a sign of pancreatic disease? Well, if a person without any traditional risk factors for diabetes, such as obesity or a family history of the condition, suddenly develops diabetes, it could indicate that something is impacting their pancreas's ability to produce insulin. And one of the potential culprits could be a disease of the pancreas. It's important to note that not everyone with pancreatic disease will develop diabetes, and not everyone with diabetes has pancreatic disease. However, a sudden onset of diabetes, particularly in the absence of other risk factors, is something that should be taken seriously and investigated further. So a sudden diagnosis of diabetes in the absence of risk factors should warrant further investigation for pancreatic disease. Understanding the connection between the pancreas and diabetes can provide valuable insight into your health and prompt early detection of potential issues. So there you have it, the first signs of pancreatic disease. Let's recap what we've discussed. Abdominal pain is one of the earliest and most common symptoms, and it's often a dull pain that starts in the upper abdomen and radiates to the back. Jaundice, characterized by yellowing of the skin and eyes, is another telltale sign, often accompanied by dark urine and light-colored stools. Then we have weight loss and loss of appetite, which could be a result of the body's inability to properly digest and absorb nutrients. And finally, unexplained diabetes or sudden changes in blood sugar levels could be an indication of pancreatic disease as well. These symptoms are your body's way of sounding an alarm. It's crucial to listen to these signals and seek medical attention if you experience any of these symptoms. Remember, early detection is key in managing pancreatic disease, so don't ignore these signs.